Hi everybody, and welcome to our webinar tonight, Privacy in Your Practice. Why have privacy breaches increased and what you should do? My name's Jenny Pearson. I'm an Education Officer for the Primary Health Network. Before we go any further, I'd like to acknowledge the traditional custodians of the land that we're meeting on tonight and pay respect to elders past, present and emerging. You all know the drill. If you can all have your microphone on mute, and please type in any questions that you have in the question box. There will be an evaluation that will pop up at the end of the webinar, and it will only take you about 10 seconds to fill in. That would be great. Tonight our presenter is Angela Mason-Lynch. Angela is a risk advisor for Avant Mutual. She has extensive experience managing practices of various disciplines and sizes, a past state and national AAPM President Fellow, Life Member and Certified Practice Manager. Angela has experience as an accreditation surveyor and assessor and a trainer for the University of New England Partnership. She's also a registered nurse. So thanks very much, and I'll hand over to you, Angela.
Thanks, Jenny, and welcome everybody. And Jenny, I'm going to ask you, if you don't mind, to let me share my screen, please, because I do want to share some slides with you. I'm sure you don't want to look at my boring old face for the whole hour.
It should be right to go.
Okay, I'm not. Let me just see.
Yes, that's right.
Beautiful. Okay, so also tonight you may have seen Amy's beautiful face on screen as well. Amy's one of my colleagues with Avant, so a lot of the things that I'll talk to you about tonight, Amy is going to forward onto Jenny, who will forward it onto you. But Amy's also available for you if you have other questions that pop up, or if you want to get her to pop into your practice. That's what she looks like. So I'm going to be talking to you about privacy breaches tonight. At Avant, we've seen a real increase in some of the complaints around privacy breaches. We think it's because of the health landscape that's changed with COVID. We're not really sure. So I'm going to give you a couple of case studies. I also think that maybe some of the mistakes happen because we're just so damn busy with COVID and with trying to manage our very angry and upset patients sometimes, that we're dropping the ball with privacy. So there's some little mistakes happening that are becoming a real headache for us as practice managers or the owners of the practice. So I want to talk to you specifically tonight about email and even mail. You know, we're still seeing mistakes with mail where privacy is being breached. I want to talk to you about SMS and mobile phone usage. This is really increased. Data checking, so still, you know, those 3 points of identification. I'm going to give you some really interesting case studies that will probably drop your jaw to the ground and might make you have a bit of a giggle. I also want to talk to you about vexatious receptionists and vexatious patients. So how you can, what you need to do when that happens, and we'll talk briefly about cyber. So first of all, if you've heard me speak before, you would have seen this slide. This is the front page to the Office of the Australian Information Commission, which is the front page. This is if patients feel like their privacy has been breached, they can easily make a complaint. Jenny, can you just confirm that my slides are moving on, because they're not looking like they are at my end?
No, they're not.
I'm wondering.
It is now.
Okay, I wonder what it was. That's okay. So long as it's moving on now, I'm happy. So, so this is the front page of the of the Privacy Commission's site, and you can see down the bottom there how to make a privacy complaint. So patients find it really, really easy to make these complaints, and they are kind of taken down a path once they start making a complaint. It's really quite interesting. You should have a look at it if you've got a spare 5 minutes, which I know none of you have, but it is really quite easy to make a privacy complaint. If they don't want to go onto the privacy website, guess what? They can go on to the, which is again not moving on. They can, oh, Jenny, it's just not working. There we are. It's just very delayed. This is the HCCC website. So for all practices in New South Wales, you will know that you have to let patients know under the 5th edition standards how to contact the HCCC. But they can easily go onto the HCCC and make a complaint as well. And again, see the big box down the left-hand side of the screen there, do you have a complaint? And again, the patient is taken down a whole lot of questions that they can ask, you know, that they can report to the HCCC about how unhappy they are about the way that their privacy has been breached, and that goes directly to the Privacy Commission as well. So it's pretty scary that it's so easy for patients to make complaints, and I think what's happening, because patients are a little bit disgruntled with the health industry at the moment anyway, they feel like you're responsible for making them wear masks when they come to the practice, or for making them be double vaxxed. So they are looking to report you anyway, and so if they think that something has happened, or something has happened to their family, them, or another patient, they're really happy to go on and make a complaint. Once a complaint goes to the HCCC or the Privacy Commission, it's really a matter of, you have to show that you're innocent, or you have to show that you've been serious about privacy, particularly if it's a privacy complaint. So sometimes a patient will make a complaint about something else, but the Privacy Commission will still hear about it, because the regulatory body might say, you know what, this sounds like the practice isn't serious about privacy. So, look, my point here is it's pretty darn easy for your patients to complain. They're cranky anyway, so let's try and make sure we have all our ducks lined up, so when a complaint, or if a complaint happens, you'll know what to do. Now, you may realise, you may not realise, that if a patient's privacy has been breached, you have a responsibility to report it if it's dangerous to the patient. So if there's a chance that it could affect the patient, then and that might be emotionally, mentally. If you think it's affected them, or it might affect them, you have to let them know. And in some cases, you also have to report it to the Privacy Commission. So I'm going to ask you a question just to make sure that you're all awake and listening to me. So on this next slide, which you'll probably get, oh, there we go, in a few seconds. Have you ever had, you obviously can't answer this online, just have a think about it. Have you ever had to notify that there's been a data breach in your practice? So have you ever had to notify the patient? Have you ever had to notify the Privacy Commission? Have you ever had to notify both? Most of you are probably going to say, I've never had to notify. If you have had to notify, I hope that you contacted your medical defence organisation first, because there's a certain way that it should be done. And often once you notify the patient, it doesn't have to go to the Privacy Commission, because the patient will go, oh, you know what, I don't really mind about that. So there's been some, and I'm sure I've told you stories before when I've presented to you about where quite a serious breach has been shared with the patient, and the patient said, you know what, that doesn't really affect me, so I don't really mind. And I'll give you an example, and I'm sorry if some of you have heard this before, but it's a very very interesting one. This was where a receptionist was asked to fax a HIV result to the hospital, and she accidentally hit the wrong digit in the fax machine, and it got faxed to a service station. So the HIV result for this patient that was in hospital got faxed to the service station. The service station attendant read the fax and saw that it was from the practice, so rang the practice and said, I've just received this fax. It's got this patient's name and a date of birth, address, blah, blah, blah. And it's got it says this is his HIV reading. And the service station attendant said, what do you want to do with this? So the receptionist straight away went, oh my goodness, that was me. I sent that. Please don't do anything with that. Please put it in an envelope and somebody will come and pick it up from you. Could you seal the envelope as well? Then she went and told the practice manager. The practice manager told the doctor went and told the patient, and the patient went, you know what, I don't really care, it's no big deal. So that didn't have to go to the Privacy Commission. Now, if that receptionist hadn't done what she did, and a lot of them won't, a lot of receptionists, and if there's receptionists listening to me tonight, a lot of you will, when you get that phone call, you might say, oh my God, that was me. Oh. And just tell the service station attendant to rip it up and apologise. But you really can't stop there, because this is a serious breach, and you need to work out what went wrong that it ended up there, and you need to let the patient know so that they have the ability to say, you know what, that does upset me because I go to that service station all the time, they know me. You know, so if you've made a breach, you need to do something with it. You can't just go, got out of that one. You know, you really need to report it up so that your managers can go, well, you know, why did this happen? Because the thing is, privacy, there's always going to be privacy breaches, because we're all human and we're also busy. And this case studies I'm going to share with you shortly explain just how easy it is, but it's how you manage it that has an effect on what the regulatory body will say if they come knocking on your door. So let's just think about your answer to that question, and let's move on to our next slide, which is about when you have to notify. So as I've said, you don't always have to notify the Privacy Commission, but you may if there's been serious harm. So there are caveats on that. For example, if you've made if you've uploaded something to My Health Record that was a privacy breach, then you do have to let the Privacy Commission know. But I'm not going to go into that. That's a whole different story. Talk to us about that if that happens in your practice. But what I want to talk about is some case studies and whether you would report them or not. So this is a flow sheet that I really encourage you to have in your practice. Now, Amy's going to send this out so that you have a copy of it. If you've got Practice Hub, you've already got it. But look, I print this out. I would print this out if I was you and have it available, because it's a really simple flow sheet. So, for example, do you know or suspect that that there's been a data breach? Well, let's go back to the service station scenario. So yeah, there has been a data breach. You've shared information about a patient that you shouldn't have shared. So yes, the answer is yes. Is the breach likely to result in serious harm to an individual? Now, this is really hard. It might, but it might not. So this is where you have to involve the doctor and ask them, and the doctor might say, yeah, you know what, this is going to cause harm to this patient. You know, if it was a I don't know, iron result, it's probably not serious harm. But then, you know, it is an address and phone number. So this is where you really have to have that conversation with the doctor of the patient and make a decision on whether it's going to be serious harm. So if it's yes, then can remedial action be taken? So what can you do? And in this case, the remedial action was the patient was phoned and it was discussed with the patient, and they said, yeah, don't worry about it. If remedial action can't be taken, so say you've, and I'll share the very famous case that I'm sure a lot of you have heard about, where a whole lot of records were not shredded properly. They were put in a bin and they were found by, you know, a person, a pedestrian walking past the bin, and that person then contacted the practice and said, I've just found all these files in here. Now, you can't really take remedial action with that because those files have been out there, they've gone somewhere, they might be on a tip somewhere that people can find this information. So that needs to be reported to the Privacy Commission. So I hope that kind of makes it clear for you when you've got a scenario that's happened in your practice, pull out this form and sit down with the doctor of the patient and say, let's work through this. I want to talk about the real increase in email privacy breaches. So we've just had so many of these lately. So one of the case study I want to share with you is this was a patient of the practice who fell pregnant, and she needed to be referred to an obstetrician. Now the obstetrician practiced out of in rooms out of the local hospital, but only one day a week. But the doctor asked for a referral to be sent to be faxed to this obstetrician. So actually it was emailed to this obstetrician. And no, it wasn't, it's faxed, I'm so sorry, it was faxed to the obstetrician. Now the obstetrician wasn't at the practice on that day, so the emails were collected by other staff at the hospital and put in a folder for the obstetrician to see when he came in. Now, it just so happened that the receptionist that was working there on that day in the hospital was a friend of the girl that had fallen pregnant. So she was so excited for this friend of hers, and she rang her and said, oh, I believe you're pregnant. So the receptionist, in effect, found out that this girl was pregnant before she'd had a chance to even tell her spouse. So this is a typical example of where, whoopsie, we've made a big blunder here. Now, you might be thinking, for goodness sakes, we can't protect ourselves against that. Like, we can't control who collects the email for the obstetrician if we've got a fax for the obstetrician if we've got a fax number for him or her. And that's not the point I'm trying to make. I'm not trying to make the point that you should have avoided this from happening. What I'm going to tell you now is that because this became a privacy breach, this was reported to the Privacy Commission by the pregnant patient, and the Privacy Commission immediately investigated the practice. So they weren't trying to say who did this and I want their butt. What they were trying to say is, practice, show me how you are serious about privacy. Show me your privacy policy. Show me that you've got a policy in place for who sends faxes and to, who checks the fax number. Same thing happens with email. We've had emails that have been sent inappropriately to, with results or with information about the patient. And when the Privacy Commission looks at it, they want to know, where's your policy on this? Where's your policy on email? Now that you're using it so often, how are we sure that you're not breaching privacy all the time? And we've only just found out about this one because the patient's reported it. So it's not about making sure you never have a privacy breach. We would love that, but the reality is that that's not going to happen. This is about having supporting documentation for us to use when we have to respond to a regulatory body on your behalf. I'll give you another email story. This is a really interesting one. I may have told you this before. I love this story. This was a GP practice that was doing vasectomies in the practice. And you may or may not know that after a vasectomy, the male has to have a negative sperm count before he can resume unprotected sex. So the result came back to the doctor that this patient who'd had a vasectomy about 6 weeks earlier had a negative sperm count, and he was therefore allowed to go ahead and have unprotected sex. So in this particular case, the practice emailed the patient, and in this particular case, it was the doctor, So it wasn't the support staff that did it, but an email went to the patient saying, just wanted to let you know that your sperm count was negative, so you can resume unprotected sex. Now, the email that it was sent to was the email that was on file for the patient, and it was actually a family email address, and the wife opened the email and read the email. Now, to throw a spanner in the works, the wife had had a hysterectomy 5 years earlier, so she didn't even know that her husband had had a vasectomy, and it did beg the question, why was he even having one? So again, it was a breach of privacy. Now, where the system fell down in this particular case is this practice was merrily, happily using emails. As we all are at the moment because of COVID, you're using email a lot more. So what are you doing as support staff, as the support people working vicariously for the doctors? What are you doing to make sure that that email address that you've got listed for the patient is okay to be used? Does the patient realise what's going to be sent to that email address? Do the doctors know that you're checking this email address to make sure that it's adequate? How are you getting the patient's consent for this to be used? So very, very important that in your email policy, you talk about who can send, what can send, who can it be sent to? Make sure that the address is confirmed, and if it's sensitive information, that it's reconfirmed at the time. Make sure that you've got evidence that the patient has consented to their email being used for this information. Make sure that you're identifying the patient properly before you send an email. So, you know, if a patient's asking for you to email them something, make sure that you're asking them to identify themselves with name, date of birth, and address as you know it. Make sure that you're saying, I need you to identify yourself, and I need you to confirm that you understand that email is not secure and you still want us to go ahead, so that the patient has the opportunity then to say, oh, I didn't realize it wasn't secure. Or, oh yeah, no, that's fine. And then great, you cut and paste that email, stick it in the medical record or against the patient file so that you've got evidence of that later on. So documentation, we really want to see that. This is what we call the defence building blocks. If something goes wrong, this is what we're going to ask you for straight away when we respond to the Privacy Commission on your behalf, or the HCCC on your behalf. So get serious about what you're putting in an envelope, what you're putting on a fax machine, what you're emailing. One of the big breaches we see a lot is you receive a request for, say, a workers' compensation. You've got a workers' compensation patient, and you receive a request for some notes. So, oh, I've got somebody talking in my backyard. I'm sorry about that. Make sure that you check what is to be sent. So we've had a recent claim where the file that was sent included information that was not necessary for this workers' compensation claim, and then it was used against the patient, so the patient made a privacy breach claim. So be very careful that you're just making that extra phone call before you release records to a third party to make sure that the patient confirms. Even if you've got a written consent, you know, that's been sent to you by a lawyer or the workers' compensation insurer, just ring the patient anyway. Because remember, if you have in the back of your mind all the time that the medical record has a shared ownership between the doctor, the practice, and the patient. So let's say, for example, you shared the ownership of a car. You're not just going to get in the car and drive it, you know, on a holiday for a week without letting the other owners know. So the same thing with the medical record. Make sure you let your patient know what you're doing with the record. Now, Jenny, I can't see any questions. Are there any popped up in relation to this? Because I know it can be contentious.
No, not yet.
All right, we'll have time at the end anyway, guys. So save up your questions if you want them answered. Look, one of the things that I like to make everybody aware of is the acronym TENDU. So if you have this in your mind before you put something in an envelope, before you put something in an email, or before you put something on a fax machine, think about consent. Have you got consent to do it? Think about the address. Have you confirmed the address that it's okay to send? Have you identified the patient correctly? And make sure you identify it on every single one of those pages, because we had another claim recently where a patient received their results, and at the very end there were the results of another patient as well, and it was actually a postnatal depression scale. You know, it's not good enough. So make sure that you check on every page what you're putting in, or what you're sending. Make sure that you document where you've sent it, and that you've received the consent, and so on. And you might get your consent on your new patient form, or you might get it when the patient comes in each time. I don't care how you get it. Make sure that that's documented somewhere, even if it's in your systems, if it's your policies and procedures. And make sure that you're always reviewing what's going on. So talk about this at your meeting. We know at your meetings, we know that in the last 20 odd months, we've seen a real increase in emails. So I hope that you're talking to your team about how this is managed in your practice, because if you're not, then you're not going to have those wide eyes. You're not going to have everybody's input into what might go wrong and how you can protect yourself against it. Let's talk about SMS communication. We've seen a bit of an increase in texting of patients. Now, if you're using a portal, like HotDoc or one of those where the patient has to identify themselves, you're very much protected. This is more of a concern with patients that you're directly consenting. And this can be a real problem because you know yourself, when you get a message, it pops up on the screen. So we've seen evidence where a patient is reminded of their appointment, and the claim I'm particularly talking about was a 16-year-old girl that had made an appointment with her doctor to have to talk about contraception. She'd done the right thing. She'd made an appointment with her doctor. She was coming by herself. But lo and behold, of course, against her name, because she's been a patient of the practice forever, against her name was her mum's mobile phone number. So the SMS, the text reminding her about her appointment, went to her mum. So again, you think, how do we protect ourselves against that? So what you might think about in your practice is, if you've seen children for a long time and now they're getting to an older age, maybe just check when they come in. Now we're using emails now to remind you about your appointment, or to remind you about your recalls, or whatever it is. We've got a mobile listed for you. Can you tell us, what number you would like us to use for this? So it's just that extra check, and I know you're busy and it's another thing for you to do, but it does help just to be wary that this is a way that you're communicating with your patients, and they need to understand that, because a 16-year-old girl might not know that that's what's going to happen, and might not realize her mum's number is against her phone number. And I'm sure a lot of you are thinking, but her mum should be coming with her anyway. That's a whole other conversation, a whole other webinar, so we won't talk about that today, but maybe that's a good topic for the next one, Jenny. So with SMS communication, make sure that somewhere you're checking that the numbers are up to date, checking that that you've got consent, that the patient understands what you're going to be SMSing them about. Make sure that there's some sort of security. So you might use a portal like HotDoc or something like that, but it's very important that you have some way of giving the patient some security. Be careful about what is sent. We know that young people, especially if you're chasing them for a recall, they don't listen to the messages if you leave a message on their phone. I remember dealing with a practice once who was trying to get a patient to come back for a pap smear. I think she was about 22, and the pap smear was quite a dangerous pap smear. The practice could not get her back, and she wouldn't. And a lot of young people don't listen to the messages, so they ended up making the decision that they were going to text her rather than leave a message on her mobile phone, which she clearly wasn't listening to. And that's a decision that you might have to make sometimes. But again, if something goes wrong, you want to be able to show the Privacy Commission that you haven't made that decision lightly, and make sure you keep everybody alert as to what you're using SMS for, so that patients' numbers are checked and correct. This is a really interesting case study. Jenny, no questions yet?
Yes, we do have a couple now.
Okay, do you want to hit me with them?
Yes. Is there a recommended email policy? I have seen the RACGP one, but wondering if this is a robust policy.
It is, but Amy, I'll get you to add to the list of things going out. We've done a fact sheet on this, and it lists exactly what you should have in your email policy.
Can I exclude all third-party correspondence when sending patient file notes to a solicitor?
Remember that the patient file notes are the patient has some say over what goes. So if it's just a solicitor's request, you should be talking to the patient about what you're going to release. If it's a subpoena, that's quite different, because that's a legal, that's by law, you have to send all the record in. But if it's a lawyer's request, then just be careful what they're requesting, and make sure that the patient has consented to what they're requesting.
And just one more, can admin staff record patient consent to transmit results, etc., in the patient's clinical file?
Yeah, this is going to be very practice specific. So it depends what your principals have given you access to do, what parts of the record you have access to. Most software programs now, even if you don't have access to the medical record, you can put it in a note that attaches to the file and will stay there forever. Some practices allow their receptionist to enter stuff in the medical record, knowing that the receptionist has signed her confidentiality statement, has been trained, and has been retrained on privacy. All right, we might move now into data checking. So this is, how you have to check the patient's name, their date of birth, and their address. So this is a really interesting case. This was, I always laugh at this one when I tell it. This was, it was actually in a country area, and there was this quite attractive patient that came into the practice, and there was a male sitting in the waiting room. He was a patient as well, and he really was attracted to this girl and had been for quite a while, and was wanting to ask her out, right? And when the female, good-looking, attractive young patient came in and the receptionist logged her in, the receptionist said to the patient, as we often do, "Oh, hi, are you, let's say, Karen Scott? Is your date of birth 25th of January and 19 whatever? Are you, is your mobile phone number still da 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 da? And are you still at blah blah blah?" So this very clever male person sitting in the waiting room took the phone number down and those other details, and phoned her that night, and she said, "How did you get my address? Sorry, how did you get my phone number?" And he said, "I got it from the medical practice." So it's very important. You have to check those details. That's really, really important. But you try and do it secretively. So you can instead of telling them what their results are and asking them, their identification is, and asking them to confirm, ask them, say, "I'm sorry, I've got to do this, but I need you to give me your name, date of birth, and address." They might still, give this information to the man sitting in the waiting room, but at least it's them giving it now. And it may change the way you do things in the future for that particular patient. She might want to fill out a form from now on, or show her license or something like that. So you've got to find a way to do it that's not going to breach privacy. Think about photo identification. That's a really great way. Most people have some sort of photo identification. So you just get them to show you their license or something like that. Sometimes a patient can enter it themselves. You know, a lot of people have got those iPads that they can enter it themselves, which is a great way. And some people just give them a piece of paper to fill it out themselves. So there's different ways that you might get the name and the date of birth and the address. You don't have to get a telephone number, but we always recommend it because that's how you generally communicate with your patient. Any questions, Jenny? I'm happy for you just to interrupt me if there is.
Yes, there is just one following on from the one we had recently. With regard to excluding third-party correspondence when sending patient notes to solicitor, what if the third-party correspondence states that it is not to be released to third parties without consent?
So who's saying it's not to be released? The patient, or so if the patient is not approving the release, then you shouldn't be doing it. If you are talking about specialist letters that have got written on the bottom, do not release without our approval, that's just rubbish. You've got to just ignore that, I'm sorry to say. Look, the Privacy Commission is, sorry, Jen?
Yes, that is what they're referring to. So if on a specialist letter, yeah.
Yeah. So basically, under the Privacy Act, whatever file you're keeping on the patient is yours and the patient's and the practice file. You can't withhold information, and they can't, specialists can't actually write that on the bottom unless it's going to be dangerous to the patient's, you know, the patient if you release it. So that's the only real caveat around that. Again, we've got a fact sheet on releasing records to a third party, and I will organise for Amy to send that as well. Amy, you better write that one down as well. Okay, let's talk about vexatious behaviours now. This astounded me, this case. This was a receptionist who was working in a medical practice, and her really good friend was in a custody battle with her husband over children. They were divorcing and they were having this custody battle. So as it happened, the husband, the father of the children that was in the custody battle, was a patient of this practice. So the receptionist went into the husband's file and extracted a whole lot of information and shared it with her best friend who was in this custody battle so that she would have more leverage for the custody of her children. So the father realised that his privacy had been breached by the practice, so he made a complaint. He actually first of all made a complaint to the practice manager. The practice manager looked at the file of this patient and could see that the receptionist had gone in and accessed medical records and accessed parts of the record that was not, you know, it was not okay for her to be looking at this part of the record. She'd been in there for quite a while, and all our software programs allow for this. So you can look at what people are doing in the medical records. You can look at under their sign in, you can see who's accessing what, and it can be quite shocking sometimes if you do random audits. So the practice manager could see that this receptionist had done the wrong thing. She confronted the receptionist. The receptionist said, I didn't do it. And the practice manager said, well, yes, you did. I can see that you did. And she was dismissed. So fair enough. Yeah, I bet you're all saying yes, that's fair enough. So the receptionist was dismissed. She had signed a confidentiality statement, but it wasn't since she started at the practice, and she had worked at the practice for about 15 years. Anyway, the receptionist then made a complaint to Fair Work that she'd been unfairly dismissed, that she'd worked, actually, I think she'd worked with the practice for 8 years, sorry. So she put this unfair dismissal claim in. So Fair Work and the Privacy Commission approached the practice and said, okay, show us that this receptionist had been trained on privacy. show us that she had signed off on the privacy protocol and understood what she was and was not supposed to do. Show us where she'd signed her confidentiality statement. Now, the practice had no evidence that she'd had training. They had no evidence that she had seen or signed the privacy policy, and she hadn't signed her confidentiality statement since the day that she started at the practice. So Fair Work said, re-employ her. Now, of course, you can imagine re-employing this person. Now, not only were the other receptionists going, oh my God, she's here working again, even though she did that terrible thing. The patient, there was a risk that the male patient, would come across her again and know that she had breached his privacy. So a real problem for the practice. So my message to you here is make sure you keep evidence of training. If you're talking about it at your meetings, document that you're talking about it. If your team are at this conference tonight, write it down somewhere so you can show the Privacy Commission that you do train your staff, that you do remind them how important it is, that when something goes wrong, you talk about it and you work out why it went wrong. Make sure that your privacy policy is appropriate for your practice, and hopefully you've looked at that recently, because that will have changed now with this increase in email. So hopefully your systems are being updated. You don't have to re-sign confidentiality statements every year, but we highly recommend that you sign the privacy policy every year, and obviously you need the training often. With vexatious behaviours too, often patients, we've got evidence of where patients have just been unhappy that you've charged them for coming to the practice. We've got evidence that patients are make a complaint because they're left in the waiting room to wait for an appointment for an hour and a half. So sometimes there's vexatious behaviours of patients as well. So again, if you have a complaint, it becomes a headache for you unless you can give us or your medical defence organisation evidence that you've trained, evidence that you've got systems, and that you've got a good privacy policy in your practice. So I can't stress that enough. You can't avoid vexatious behaviours. There's always going to be people that want to do the wrong thing. Just make sure that you protect yourself if something comes in and it's too late once it's happened. You need to be preparing yourselves now. Look, cyber attack, we have seen such an increase in cyber. We think it's because people have been stuck at home in isolation, and so they've worked out how to attack. And unfortunately, a lot of the attacks come from overseas, but we are a highly sought after industry because generally we don't do this extremely well. General practice is better than specialist, but we still need to tidy ourselves up and make sure that we're doing the right thing. What we're finding the most is when we have a cyber attack is that practices, although they're doing a backup every day, they are not actually doing a restore from backup. So when they have a cyber attack and they're completely shut down, they close their computers down, and then they get their IT people to restore from the last backup, it doesn't work. So they're losing information because they actually haven't got a backup. Look, make sure that you've got a backup. Make sure that your backup's working. Make sure that your IT provider is doing a restore from backup. Do we have any questions yet, Jenny, on any of those?
Yes, we do. Is there a confidentiality letter that is recommended for staff to sign? We have something in the contract. Do we need a separate confidentiality agreement?
No, you don't. In your contract is fine, but you definitely need a privacy policy and you definitely need your privacy training.
And one other, it's not really a question, but any information on the training, etc., for privacy, as Angela is talking about, would be greatly appreciated.
Yep. So look, what you can do, so Amy's going to send you quite a bit of information. You know what? You could just, for example, the release of records to a third party, you could just use that as an education tool yourself. Get your team to read it and put it down as education. That's fine. If you've got Practice Hub, there's actually privacy modules in Practice Hub. This is a perfect example. I think we may even at Avant have some privacy webinars. If you're a member of Avant, you can go on and have those webinars for free. There's quite a few different avenues that you can use for your privacy education. Just make sure it's documented. And you know what? Documentation can be a piece of paper with, you know, what was discussed, who was the authority on it, when it was, and who attended, and just list it down and keep it in an education folder.
That's great. There will be a certificate, everyone, coming out from tonight, so you'll have that for some proof. There's one more thing, one more question. How often do you recommend doing a restore from backup?
Yeah, you know what, that is a fantastic question. The standards say reasonably regularly, which I always think is such a lawyer thing to say. Look, 3 monthly, you know, would be fine. More often would be great, but I get that it's pretty crazy out there. You just want to make sure it's working. You just want to make sure it's working. That's what it's all about. I think I've got, so this was, I want you to think now about some of the things that have happened in your practice, and I want you to think about whether or not you should have notified there was a data breach. So have a think about what's happened in your practice over the last 12 months, and perhaps there might be things now that you know should have possibly been reported either to the patient or maybe even to the Privacy Commission. Look, I must say, I was doing a presentation with somebody from the Privacy Commission about 3 years ago, and I said to her, how many of the notifications are actually real notifications? And she said to me, about 30%. So that was 3 years ago. So I think in the beginning, practices were probably over notifying. And it's probably a little bit of a drastic step. I think a lot of times it's probably better to look at remedial action first, and in most cases you can make some sort of remedial action. That's the end of my seminar. My take-home messages for you are to document your systems. Make sure that you've got them in place and that they're relevant. Train your team and keep evidence that they've had that training. Know your systems and how they work. So if you're sending an email, make sure you know what the process for your practice is. Review what everybody is doing in your practice. So review, you know, talk about it at meetings. How do we send emails? How often are we sending them? How are we checking that those details are correct that we have on file? Think before you send, fax or post. So remember that can do. Think about that, use that acronym, and you can have a PDF copy of my PowerPoint presentation. Remember how easy it is to complain, and also remember that a complaint is a real pain for your practice manager and your principal to manage. It takes a long time, and you're almost guilty until you can prove yourself innocent. Remember that what you do in your practice reflects, so your behaviors reflect the credibility of your practice. So you might just think, oh, I'll just do this because I'm really busy now, but that one little thing that you do wrong can really affect the credibility of your practice moving forward. So then the patient's got one little thing that's upset them. If they then have to wait for an hour, they've got another thing that upsets them, and then they're charged for their consult, they've got another thing that upsets them. All of a sudden you've got a complaint. So we really can't afford to do the wrong thing. Any questions from anybody? And I've just put up our medical advisory line if something does go wrong.
No more questions have come through. We will have this, Angela has has agreed that we can have this up in our education library. So it will be there as a resource. So you can use it for training of your staff, which is just fantastic. I don't think there's anything else that we need to talk about. We're winding down to the end of the year. So thank you very much, Angela. That was really good. And thanks everybody for attending. We do have a couple more webinars over the next few weeks, and then it'll be great to have a break. Very well deserved for everybody. All right, thanks everybody, and good night.
Thanks everybody. Good night.